Hello, my name is Jessica Pinuelos. I am making a video for my ECE-411 Early Cognition and Learning 1, the preschool year classroom. Today is October 30th, 2023. My first topic is auditory development. Auditory development refers to the process when the fetus begins to perceive sound, which starts in the utero and will continue after birth. This was a surprise for me. I did not know that the auditory process started before birth. A fetus can hear their mother's heartbeat and respond to sound and voices by week 24. So by week 24, the fetus can hear the mommy's or the daddy's voice and hear sounds in the environment. How do pregnant mothers know the fetus is able to hear? This question was interesting to me as I asked it. They feel movement and pulse will increase if checked. So if you talk to the fetus when you're pregnant, and then you check your pulse, you will see that it went up. The auditory development is important to know as a parent and an educator, as you need to be aware if the child's able to hear normally. And that's, it could be at any age, but infants and toddlers, infants, if you talk to them, then they will turn their head. Even in preschool, do they hear your voice? Do they turn? Do you think they ignore you? Do they hear sounds in the environment? My next topic is articulatory development. Newborns are able to distinguish between 4 different cries, and that was new to me too. That is, the first time they cry is at birth. It only happens one time, and it's clear. They're trying to clear the fluid from their lungs, from the newborn's lungs. They can cry when they're in pain. Usually this is louder and it's not as normal. Sometimes you will try to comfort them, and the infant will not be comfortable. It'll be hard to comfort them if they're in pain. The most common one is hunger. The hunger cry is the most frequent in infants, as they do eat often. And mothers or teachers, primary caregivers, will distinguish this hunger cry as it happens every couple hours. Sometimes they cry for pleasure. It's the least one used by the infant. As they get older, it will help them develop language skills. So the pleasure one, it might be kind of not as often, but they do have a pleasure cry. In ECS, articulatory development, is important to have understanding as the first 3 months, the infant will use different cries to communicate. So as an educator, you need to be aware of the 3 different ones. The educator will need to be able to distinguish between them to comfort the infant or meet their needs individually. That means they need to get fed, they need comfort, or if they're in pain, you need to be able to distinguish between all 3 of them. Some things to keep in mind are the infants can suck, cry, cough, and smile. One of the quotes from the textbook when noted that up to 6 months, the infant sounds are 90% consonants. That's from Bornstein on page 409. The first words will typically happen when young children are able to imitate, play, and explore objects. They produce sounds as broom, bam, bam. They're popular in actions or toys. It's more than babbling now. This is more of the sounds and they do with actions before they start to produce real words. Normally, an infant around 12 months will say their first words. Typically 5 words at an average, as some of the children might have none. Some examples are mama, dada, doggy, kitty, juice, and milk. Infants can comprehend around 50 words by around 15 months. Infant and toddlers. 2-year-olds have about 150 words is the norm. By age 6, the average vocabulary is 14,000 words. By age 40, adults have the average of vocabulary of 40,000 words that they typically use in the workforce. In ECE, it's important to see the growth in language development. Use tools to track weekly growth. one of my, in my community, we hear a lot talk, read, and sing will be the key to support children in their language development at home and at school. So if you talk to them, read, and sing to them, their vocabulary will increase. A child must learn at least 3 new words each day from birth. That's a quote from the book Bornstein. Grammar development. Grammar development stage in early childhood means that children are speaking in sentence in the correct order. Usually young children start putting 2 to 3 words together, even if they're hard to understand by the adult. Children have figure out how to put words together and their meanings to make sense. Children will communicate their wants and their needs. So this is typically when they're able to speak clear sentences and you understand what they're saying, even if it's only 2 to 3 words. If they're out of order, it could be a little bit typical, but teachers, educators should be making observations to make sure that they're increasing in their grammar. In my conclusion, all these stages of development are important for educators to know this information because it allows them to see red flags or areas of growth. A lot of parents need resources, and educators are the first ones in line besides the child's pediatrician. It's important that children are not, if they're not developing language skills, that the first thing the parent and educator can do is have their hearing tested. They can also see their pediatrician or get a referred to speech pathologist. As many as 3 out of 1,000 newborns have hearing loss, which can cause delay in speech development. Which that's more than I thought. I was pretty surprised by this. Thank you. My resources are a Bornstein, the textbook, and then a website, webmd.com, baby, SS slideshow, fetal development, and then webmd.com, parenting baby talk, your baby's first words. Thank you for listening.